Hi, my name is Mona Kim, and I will be presenting the cons for A3731, which extends child support in case of addiction. This is an amendment to the NJS 2A 3423. Assembly 3731 has a revised section. Previously in Senate number 2750, it says that severe mental or physical incapacity shall not include a child's abuse or addiction to alcohol or controlled substances. This bill was taken into effect October 1st, 2013. A3731 says if mutually agreed by both parties, or if the court determines so, a child's addiction to alcohol or controlled substances can lead to severe mental or physical incapacity. The court will consider several factors that determine a severe or mental incapacity of that child. What is A3731? This could justify the continuation of child support after the age of majority, which is 18 in New Jersey. This justification stems from the child's mental and physical inability to live without support from their parents. Child support cannot terminate solely on a child's age, if that child is suffering from a severe mental and physical incapacity. This policy concerns the emancipation of a child, or when this child does not feel dependent on his or her parents. There is an obligation to pay support and will continue until the court finds that the child is relieved of the incapacity or is no longer financially dependent on the parent. The primary sponsor is Troy Singleton, who is a Democrat. However, there are other sponsors for the previous drafts and enacted bill. This also comes from the Women and Children Committee, who handles issues concerning statuses of women, families, and the welfare of children. Other facts: if any matrimonial action such as divorce occurs, the court may make an order for parents to continue giving care, custody, education, and maintenance of the children. If any party neglects this, the court may issue an immediate sequestration or seizing of the personal estate, rents and profits of that estate as well, and appoint the receiver to maintain that child support. The court will review the financial capacity of each party, along with other factors that would determine the amount to be paid for child support. What is child support? All dependent children have a legal right to be financially supported by their parents. In New Jersey, this continues until the children are emancipated or until a court orders otherwise. If one parent seeks to terminate their child support obligation, a court order must be put in place for child support. There is no fixed age in New Jersey when support stops. Once a child turns 18 and/or becomes financially independent, either parent, if they want to, must file papers with the court asking the order to be terminated or adjusted. So some history. The Child Support Enforcement, the CSE, is a program founded in 1975 to help strengthen families by securing financial support from non-custodial parents, which is funded by both state and federal dollars. The Child Support Performance and Incentive Act of 1998 provides penalties for failure to meet data processing requirements, reforms incentive payments, and provides penalties for violating interjurisdictional adoption requirements. These incentive payments are based on paternity establishment, order establishment, current support collected, cases paying past due support, and cost effectiveness on the percentage of collections. This incentive payments must be reinvested back into the state's child support program. Also, New Jersey Rules of Court says that the age of majority is 18 years old, unless the child is still attending high school or secondary school. What A3731's goal is to extend child support for these children over the age of 18 who have a severe mental or physical incapacity. Their goal is to reduce possible relapse, strengthen support systems, and lessen financial, mental, and physical burdens on children. As you can see, there are major problems in New Jersey. This is a statistic study done by the CDC. In New Jersey, at least one drink, at least those high school students who had one drink of alcohol on at least one day in New Jersey was 39.3%, in the United States was 34.9%. Ever used marijuana was 37% in New Jersey and 40% in the United States. Ever used inhalants was 10% in New Jersey and 11% in the United States. Ever used cocaine was 4.8% in New Jersey and 5.5% in the United States. Lastly, whoever used heroin, 2.4% in New Jersey and 2.2% in the United States. Now we'll be going over the stakeholder analysis. In high importance and high influence are the state government, who addresses issues about the factors of child support. The hospitals are also in high influence and high importance because they are have to address those who are addicted that may have to be hospitalized for abuse. In medium influence and high importance are families of the child who are abusing drugs and alcohol because they will feel the direct impact of the child support. Medium influence and medium importance are treatment centers who have to concern the children who have to be admitted. And medium influence and low importance are law enforcement who are involved with issues with the children who use, such as arrests and processing. Low influence and high importance are alcohol and drug abusing children because they will have that financial support from their parents. And low influence and medium importance are communities surrounding these alcohol and drug abusing children who will receive support. Some lenses that we need to look at are negative economic lens. The state government will see this in a negative economic lens because they will see a decrease in productivity as well with treatment centers and hospitals. Families will also see a negative economic lens because these parents are supporting their adult children with their own personal finances. Also, law enforcement will see a negative economic lens because they will have to uh, arrest more children and would have to um, decrease their productivity. Negative legal lens would be the state government because they would see it as illegal to lend hand to those who are abusing drugs and alcohol. Negative moral lens are the families because they may see extending child support as a handicap and possibly not helping these children who need to learn how to get back on their feet on their own. Positive economic lens are the children of addiction and also hospitals and treatment centers who will also see an increased revenue from the increase of children of addiction. Positive public health lens are the health communities who will see that because these children are seeking to help and going to addiction treatment centers because they have the support now through the center, through the child support, they will see that is a much safer environment to live in. Positive moral lens are the families and communities which see as a morally right to extend help to those who are in need because these children are physically incapable of living on their own because they need help for this addiction. They should be receiving it. And lastly, positive medical lens or the hospitals and treatment centers who have the technology to treat these illnesses, these addictions. You want to support your child, not to handicap them. Many children might believe that this continued support will help children get back on their feet. This is not always true. A Forbes Women online poll and National Endowment for Financial Education conducted a survey and results showed that nearly 60% of parents provide financial support for adult children over the age of 18. There might be a correlation in increasing alcohol and drug use in New Jersey because of this financial relief. This financial back support can be crippling. This continued support can create a dependency to the parent. Instead, parents should look for alternatives and create incentives for children with addictions to go to treatment centers. Parents should continue to support their children through encouragement, Parents should also educate themselves about alcohol and substance addiction so they know how their child is feeling and create opportunities for them not to use by filling their days with activities. Is still child support, so the child will not be completely independent. Lastly, are the principles of effectiveness. Is it well known? Not publicly well known because it is not passed yet. However, the Senate 2750 was passed, does not include the severe mental or physical incapacity. Most people only have a general idea of what child support is, let alone that child support stops at 18. This assembly is looking to have child support after the age of 18. Is it understandable? Somewhat. The court gets to decide on the status of the severe mental or physical incapacity. This could be subjected to bias. And there's also wiggle room of the amount of to be paid that has a number of factors to be considered. Because these children and parents don't know when these children will no longer need help. Is it consistent with community norms? Yes and no. Some community members may see that this is beneficial for these members because they are receiving the help they need to get back on their feet. And on the other side, it cannot be consistent with community norms because they will see these increase of children who are addicted going to hospitals and treatment centers where other people who are not using drugs or alcohol need to use it and decreasing their productivity. Lastly, are there consequences? Yes, because there are dependency on the parent, these parents will see an economic hardship. There's an unknown longevity because these parents don't know when the child will be relieved of the incapacity or will no longer be dependent on the parent. However, we must always look for the pros and cons of each policy. There is always stakeholders will argue for both sides, and it is important to take into effect all views to understand the full bill. Thank you.